Coming to parturition, parturition means birth of the baby. Towards the end of pregnancy, the uterus becomes progressively more excitable until finally it develops strong rhythmic contraction so that baby is expelled. The process of parturition is divided into three stages. The first stage is dilatation of the cervix, second phase is expulsion of the fetus with membranes, and third phase is expulsion of the placenta from the uterus. The first stage, that is initiation of the labor. Initiation is usually indicated by the appearance of labor pains, which are due to the conversion of slow and rhythmic uterine contraction, that is Braxton Hicks contraction, to a strong and powerful contractions. These contractions become stronger at full term and force the baby through the birth canal, thereby causing parturition. Mainly two categories of effects lead up to intense contraction responsible for parturition, that is the hormonal factors that increases the excitability of the uterine musculature and the mechanical factors that increases uterine contractility. Hormonal factors which are responsible: there is increased ratio of estrogens to progesterone. The high estrogen to progesterone ratio sensitizes the uterus to stretch prostaglandins and oxytocin. The estrogen has a definite tendency to increase degree of uterine contraction as they increase the number of gap junction between adjacent uterine smooth muscle cells. From the 7th month of pregnancy, estrogen secretion continues to increase while progesterone secretion remains constant or even decreases slightly, and thereby maintaining a high estrogen progesterone ratio. Then the effect of oxytocin on uterus. Oxytocin appears to play a prominent role in the process of parturition. It facilitates parturition by causing contraction of estrogen primed uterus. The uterine muscle increases its oxytocin receptors near term, and also the rate of oxytocin secretion by neurohypophysis is considerably increased at the time of labor. Then the effect of fetal hormones on the uterus. The fetal pituitary gland secretes increasing quantities of oxytocin and plays a role in exciting the uterus. The fetal adrenal glands secrete large quantities of cortisol, which is uterine stimulant. The fetal membranes release prostaglandins in high concentration at the time of labor, which increases the intensity of uterine contraction as well. Some of the mechanical factors which are related to parturition are stretch of the uterine musculature, that is uterine muscle is being a visceral type of smooth muscle, contracts when stretched. The sensitized uterus, when stretched by the fully developed fetus, brings out powerful contraction. And second is stretch of or irritation of the cervix. Stretching of the or irritation of the nerves of the cervix initiates reflexes to the body of the uterus, which may result in a powerful contractions. So this is how the parturition occurs. Mainly occurs because of the body is pressed against the cervix and there will be cervical dilatation. How the parturition is going to be initiated, and further cervical dilatation causes the stimulation of the hypothalamus, which increases more amount of oxytocin from posterior pituitary, which reaches the uterus and acts on the uterine muscles to increase the contraction of the uterus, and also they release prostaglandins, which acts on the uterus and the cervix for the cervical, which facilitates cervical dilatation. And for the cervical dilatation, it makes a passage for the baby to enter into the vaginal tract, and when the baby enters into the vaginal tract, that impulses from the vagina goes to the hypothalamus. Again, they will increase the secretion of oxytocin, so ultimately that will lead to the expulsion of the baby.